Interview and counseling, both of them fall under individual approach, individual approach of health communication, or person to person communication, or interpersonal communication. First, let's look at interview and then we are going to follow that with counseling. So interview. In interview, there is one person who asks question, and this person who asks question is the interviewer, and then there's another person who gives answers to those questions, and the person is your interviewee. So basically, interviewer is the person who takes the interview, and interviewee is the person who gives the interview. Let's look at the various types of interview. First, you have your direct or structured interview, where there's a structure to be followed. Basically, there are questions that are already set or predetermined. The interviewer needs to ask these questions to the interviewee only. And then there's indirect or unstructured interview. Basically, there is no structure or there is no predetermined questions. The interviewer comes and then talks or discusses with the interviewee in a friendly manner and gets information out of him. And there's focused interview. For example, there's an audience watching movie in a hall. The interviewer, instead of talking with the audience, simply observes their reaction. So studying reaction towards a certain movie, that's your focused interview. Then there's repetitive interview, where the same question is asked repetitively. There is, and then the gradual change in answer is noted down. So gradual, it's a gradual process. For example, there's a patient in a ward, and then you ask that patient, how are you doing, every day. In day 1 the same question, day 2 the same question, day 3 the same question. The answer going to change as per the day. Maybe in day 1 the patient is okay, so he says I'm doing all right. In day 2 it's pretty bad, so he's not good with the day. Basically, he's not doing well. In day 3 maybe he's neutral. In day 4 he's quite happy. So the answer changes as per the day for the same question, and that gradual change in answer is noted down. So that's a repetitive interview. So you have direct or structured interview, where there are predetermined questions, indirect or unstructured interview, where there are no predetermined questions, and focused interview, where reaction towards something is studied, and repetitive interview, where the gradual process is studied. Okay, let's look at the technique of interview. Let's say you are an interviewer and you are going to take interview of a certain person. What are the steps to be taken in order to have a successful interview taken place? First, First, you need to establish contact. You can't just directly go to the person and immediately ask. Maybe this person is a business tycoon. You can't just ask, okay, so how did you reach in this stage of business success? You can't directly get into the question. First, you need to develop a contact. First, the interviewer introduces himself. My name is this, I do this, I'm from here, and makes himself familiar with the interviewee. Now you can start the interview through general discussion. Again, don't directly ask about the success of his business. Ask him how was his day? What did he eat? So how is his family doing? Then you start securing rapport with the help of general discussion. So what did you eat in the morning? What do you like to eat? What's your favorite movie? Once the rapport is built, that is, once a healthy relationship is built between you as an interviewer and the business tycoon, now you can start slowly getting into the main topic of discussion by first recalling everything. That is, you recall the interview or make him understand that the interview is going to be about business success. So you and this business tycoon, now you guys are talking about business success. You are interviewing him, is giving answers properly. Now all of a sudden, this business tycoon was talking about business success. Then he talks about his son and then how his son is doing in the school. So now the interviewee has diverted away from the main topic of discussion. Instead of directly telling him to come back to business success, which is going to offend him. Obviously, you can't just directly say, no, I don't want to know about your son, tell me about your business success. That is going to offend him. What you can do instead is that ask him questions that is going to bring him back to the main topic of discussion. Not direct questions. Ask him, Mm, Curious questions like, okay, so your son is in school, right? Is he interested in business as well? The answer can be yes or no, and slowly the interview is brought back to business. And these questions that you ask to the interviewee when he gets sidetracked to bring him back to the main topic of discussion is what you call probe questions. Questions of mere curiosity when the interviewee sidetracks important aspect of problem. You can encourage the interviewee and then guide the interview into the subject matter by asking more probe questions. And then one important thing is that during interview, recording should be minimum. Because if the interviewee knows that recording is going on, that's gonna be in his subconscious mind and he won't be able to open up properly. So minimum recording during the interview. Then once you are done, you have all the information. You can't just abruptly end the interview by saying, okay, thank you for your information. I'm gone now. Tata. No, you must give a proper closing to it. You should thank the interviewee and then close it. And once the interview is done, everything is noted down. You have all the information. Obviously, you need to make a compilation or make a report of everything that you learned through that interview. So, first, you started the interview through general discussion by developing contact and securing rapport. Then, as the interview went on, sometimes the interviewee got diverted away. You brought him back to the main discussion through probe questions and then guided him into the subject matter. You made sure to make recording as minimum as possible so that it does not stay in the subconscious mind of the interviewee. And then finally, after getting all the information, you closed the interview properly by thanking the interviewee and then made a report out of it. That's the technique of interview. You can look at the advantages and limitations on your own. I want to keep this video short and sweet, so let's get directly into counseling. What is counseling? In counseling, there is one person who try to find out the problem and give solution to of another person. Okay, let me rewind. So there's one person who tries to find the problem of another person as well as give solutions to the problems of this person. What are the characters of a good counselor? Let's say you, as a patient, went to a doctor. For this doctor to be a good counselor, what characters should he possess? The doctor should be respecting. That is, let's say you tell the doctor your problem and the doctor starts laughing at you. Obviously, that's not respectful, and you are not going to want to listen to him. So the doctor must be respecting. He should be sympathetic. You tell him about his leg pain, and then he starts telling you how that leg pain has no value in your life and how it means nothing. That's not sympathetic. So he needs to be sympathetic. At least he should accept the fact that your leg is injured. He should be understanding. He should understand the fact that you are going through pain and that's not okay. He should be patient. That is, you are telling him about his pain and all of a sudden he abrupts you because he wants to talk to someone on his phone, or maybe he's bored with everything you say. No, he has to listen to everything that you are saying so that he can gain your trust. So he must be trustworthy. Obviously, once he has listened to your problem, his job is to find the solution to the problem. So he must be a problem solver. He must be a good listener, and that's where patience is required. And obviously, you want to listen, you trust someone, you trust that person who is friendly to you, and you give away all the information to that person who is friendly to you. And obviously, politeness is necessary for psychological aspect. You like to talk to someone, you like to give away information to someone who is polite to you as well. You open up to someone who is polite and friendly to you. So those are the various characters of a good counselor. So what are the elements of counseling? Basically, what are the procedures to be followed while counseling? We follow the gather approach. Let's take an example. Maybe let's say you are a counselor and you are counseling a couple for contraceptive use. What will you do? So you are a counselor, a couple approaches you, and then they approach you for contraceptive use. Basically, which contraceptive measure to be used, what are the steps to be taken. This is what you do. So as a counselor, first you greet the couple. Good day, come on, sit down, there's a sofa ready, it's comfy, sit on the sofa. Okay, they are seated on the sofa now. Then you ask them their problem. So what exactly do they want? They want the contraceptive measure to be used. So you tell them all the possibilities or possible options of contraceptions. Obviously, they are going to get confused which one to choose. So you help them choose the appropriate contraceptive measure as per their condition. Once you have chosen the contraceptive measure, you obviously need to explain them why that was the choice. What are the advantages of choosing that particular option? And once you have explained them, you ask them to return back for a follow up. So, what's the gather of approach? G for grit, A for ask, T for tell, H for help, E for explain, and R for return.